10 years ago this month, I found a lump in my breast, which proved to be a malignant tumor. My outlook was serious, and it was determined that my best chance for treatment after surgery and chemo was a bone marrow transplant. At the time of diagnosis, my husband's employer did not provide health insurance, and with 3 young children, we could not afford private insurance. Brenda Keith, my own personal earth angel, was the oncology nurse in charge of the BMT unit at Good Samaritan Hospital in Phoenix, and it was she who went to bat for me. She went head-to-head with 2 hospitals and 2 government-run insurance groups on my behalf, and she succeeded in getting them all to agree and cooperate so that I could have my treatment in Phoenix. As you can tell by my presence here today, the treatment was successful, due not only to the great skill of the doctors there, but in large part to Brenda's skill and resourcefulness as an administrator, as well as her caring heart and her excellent nursing. It would be impossible to adequately express my gratitude to her and all the other wonderful nurses who helped me through that very difficult time. It's an honor to be here today to publicly thank them all. And I may look like just one person standing up here today, but behind me, though you can't see them, are just as many people as there are out there. They're the patients who don't have the opportunity to be here today. And on behalf of all of them, I want to thank all of you who do this wonderful work, and especially Brenda, my own special angel. Thank you, all of you. You're the best.
On July 5th of last year, at 13 weeks pregnant, I was diagnosed with acute myelogenous leukemia. Janine, my clinical nurse specialist, was very supportive. She encouraged me to keep going when things got tough. I could always count on Janine to stop by and give me a pep talk, when I just wasn't sure the day was going to, come to an end. I don't know how I would have gotten through some of those days without her caring and compassion. She was willing to pray with me like friends do, and she became someone I could talk to about anything, and talk we did. It was Janine that encouraged me to participate in Dr. Beck's research study related to pain, and I have been blessed, not only by God, but by all the nurses and Janine at St. Vincent's Healthcare, and thanks to them, we're all here today.
Amanda, I'm really glad that Janine was there for you, and especially for Isaiah. And Janine and Susan, I'm glad that the foundation was able to fund the research study that resulted in larger dollars supporting oncology nursing research, incorporating nurses and patients from around our country. Join me as we applaud these stellar nurses and their very special patients. The stories you just heard incorporates all the components that the Foundation believes is the core of our future: nursing research, leadership, and education. For the Foundation to continue to do the work we do, we need to grow and sustain the financial strength to move forward. As a foundation, we understand the importance of taking the responsibility to step forward to lead this dedicated effort. We know beyond a shadow of a doubt that we cannot do this work alone. If we are to influence and support the future of oncology nursing, we must do this together.